Okay, so this presentation is on the opioid crisis. Opioids are a class of drugs that include the illegal drug heroin, synthetic opioids such as fentanyl and pain relievers available illegally by prescription such as oxycodone, hydrocodone, codeine, morphine, and many others. And this is as classified by the NIH, the National Institute of Health. So our problem is, looking at our problem, we've got data from 2018 telling us that there were 128 Americans that died each day due to misuse of opioids, and about a third of those patients were prescribed the opioids who misused them. In the Midwestern region, we had a 70% increase in opioid overdoses in the span of about a year. It's been gathered that there's a rising incidence of neonatal abstinence syndrome due to opioid use and misuse during pregnancy. The increase in injection drug use has also been contributed to the spread of infectious diseases, including HIV and Hep C. The CDC and prevention estimates that the total economic burden of prescription opioid misuse alone in the U.S. is $78.5 billion per year, including the costs of healthcare, lost productivity, addiction treatment, and criminal justice involvement. So, looking at the timeline of the opioid crisis, in 1995, Purdue Pharma received approval for Oxycontin, a powerful opioid, and in 2007, Purdue paid a $634 million fine for lying about it. Prescriptions for opioids tripled between 1991 and 2011. In 2010, Purdue released an abuse-resistant formulation of Oxycontin. This marked the beginning of the heroin epidemic. Deaths from prescription opioids alone are rare, and it's important to note that the opioid crisis does not come from one single origin. It is a multifaceted issue. Looking at the opioid epidemic by the numbers, this is a study or data taken from 2018. So we've got 130 plus people dying every day from opioid-related drug overdoses. It's estimated that 10.3 million people misused prescription opioids in 2018 alone. 47,600 people died from overdosing on opioids. 2 million had an opioid use disorder in 2018. 808,000 used heroin in 2018. It goes on. So you can see the stats are not great. However, from 2017, a lot of these numbers are actually lower. So there's a few things that, we're making progress towards, and two of those include the NIH's HEAL initiative and the HHS's 5-point strategy. So the HEAL initiative was launched in 2018 in April and is funded by Congress. It helps to end addiction long-term. That is what the HEAL stands for. Solutions include improving treatment strategies for pain as well as opioid use disorders, and the initiative is funding hundreds of projects across our nation, and almost every NIH Institute center is advancing their research in order to better encompass and address the issue at hand. As far as the HHS's 5-point strategy, the HHS is actively working to solve this issue, and their 5 points are access, data, pain, overdoses, and research. Improving in all those areas, figuring out better ways for pain management. That one's pretty important because if we go back, I don't know if I can go back, but the amount of opioids being prescribed had very much increased, and so if we can find better ways for pain management that wouldn't involve prescribing opioids, we could hopefully prevent a lot of future misuse. Furthermore, some of these facts on the 5-point strategy, looking into each section in particular, because this is a really important part of the policy for the opioid crisis, looking at access. In 2017, they were issued more than $800 million in grants to support treatment, prevention, and recovery efforts. One example is the first responders as a part of the Comprehensive Addiction and Recovery Act. The purpose of this program in particular is to provide training and medication for emergency treatment of opioids. Data. Pain. Something that I found interesting is the Indian Health Service has established a national committee on known as HOPE that will work to provide safe and effective pain management and prevent opioid misuse. So we've got even more specialized services for different areas in the country and different groups of people, and it's not just one. It's not just targeted for some people. It's something that affects everybody, and so it's important to have these things accessible to everyone and in as many locations as possible, because this is an epidemic across our country. So looking at Oklahoma policy in particular, there's a strong effort to reduce opioid misuse among mothers, because that's a really large issue, and then a lot of these times the babies are born addicted, because that's how that works when the mother is misusing opioids while during her pregnancy. And it's a large issue because, that starts off the children's lives so difficult already. And then we look at youth and young adults and how they're endangered by this drug, and that can come from being injured and maybe being prescribed opioid pain medications and not knowing or not having enough education on how to deal with that afterwards. And so the Commission recommended training for middle school and high school student athletes and coaches on the risk of addiction to opioid pain medications after sports injuries. They've also encouraged the use of early intervention screening tools. And actually, many dentists are choosing not to prescribe opioids for impacted wisdom teeth and are conscientiously avoiding prescribing to teenage patients that may be opioid naive. Another interesting thing is looking at students in recovery, and this is from the Oklahoma Commission on Opioid Abuse, their final report from last year. The Commission heard a presentation from Dustin Huckabee, president of the OU Students in Recovery organization. He explained that there is a lack of university-provided recovery support services, and this organization is working to help students succeed in college while maintaining and working through recovery. Currently, OU does not offer sober living options on campus. The Students in Recovery organization's goal is to create a safe, sober place on campus, and they have currently raised over $16,000 to help in this effort. They host sober tailgates and 12-step meetings for students. Mr. Huckabee stated that the collegiate recovery method has been shown to reduce the time of relapse cycles by 15 years, as students get earlier help and support created specifically for the college experience. Then we look at the PMP, which is an invaluable tool used to combat the effects of opioid epidemic. Currently, prescribers are required to check this 180 days.